to open NCDs in the Americas, Awareness, Access, and Action, I'll call Ambassador Albert Randin, Assistant Secretary General to the Organization of American States. Ambassador, please.
Good morning to all, and I want to mention quickly that interpretation is available for those who need in Spanish and in English. Your Excellencies, Ministers of Health of the Americas, with a special welcome to the Minister of Health of Trinidad and Tobago, Dr. Fuad Khan, Madam Chair of the Permanent Council, Ambassador Sonia Johnny of St. Lucia, Ambassador Neil Parsan, Permanent Representative to the Organization of American States, distinguished permanent representatives and ambassadors, delegates, our collaborators from the business community, the Vice President of Medtronic Philanthropy, Dr. Jacob Gale, and the Medtronic team led by Dr. Trevor Gunn, representative from General Electric, speakers and panelists, ladies and gentlemen. Welcome to the Organization of American States and to this special conference, NCDs in the Americas, Awareness, Action, and Access, a title which I believe encapsulates the key objectives of the discussion today. Ladies and gentlemen, we collectively need to raise the level of awareness and understanding at the political and legislative levels in our countries, push for more initiatives, resources, and action to not only treat NCDs, but also to prevent them, with a special focus on the youth, and also to put in place systems and services which are accessible and affordable to all. If we do not act, the cost will be enormous. According to a study of the World Economic Forum and the Harvard School of Public Health, it is estimated that if we don't act, NCDs, and I quote, NCDs will cost the world economy $47 trillion over the next 20 years, representing 75% of global GDP, surpassing the cost of the global financial crisis, end of quote. These are indeed staggering and disturbing numbers. NCDs are an issue of growing concern on the international agenda and an immediate threat to our societies in the Americas. Here are some statistics to illustrate the seriousness of this health threat. Statistics which I've taken out of the publication which the Pan American Health Organization so kindly put together for this conference and which you have received copies. In the Americas, it is estimated that approximately 200 million people live with an NCD. That is 2/3 of the population of the United States of America, and that's twice the size of the population of Mexico. Non-communicable diseases are now responsible for over 80% of all deaths in the Americas. Almost 4 million people annually die because of NCDs. In 2010, non-communicable diseases in adults surpassed communicable diseases in children as the leading cause of deaths in Latin America and the Caribbean. Another statistic, the poor are disproportionately affected by NCDs. Almost 30% of the premature deaths from cerebrovascular diseases in the Americas occur in the poorest 20% of the population. The Americas has some of the highest rates of diabetes, which is responsible for 260,000 deaths every year. The number of people living with diabetes in the Americas is estimated at 62.1 million in 2011 and expected to increase to 91.1 million in 2030. In the Americas, 40% of NCD deaths occur in people under 70 years of age, and 20% of all NCD deaths occur in the working age individuals under 60 years old. So, ladies and gentlemen, clearly this is concerning. Over the past years, much has been done to tackle these statistics. Efforts have been made at the national, regional, and global level, and that is a good thing. But we clearly need to increase our efforts at all levels. The Americas need a comprehensive, a multifaceted, and integral regional strategy aimed at reducing the incidence and prevalence of NCDs in our societies. Given the relatively limited resources, the strategy should include priorities by area and sub-region, be innovative in terms of treatment and the use of technology, as well as a strategy that is realistic and measurable in terms of its impact. OAS member states need to focus indeed, as we heard this morning, but to repeat here, focus on prevention, early detection, and healthy aging. The general public must be educated in order to decrease leading behaviors that increase risks of NCDs, namely tobacco use, harmful alcohol use, physical inactivity, and eating unhealthy diets, including consuming excess salts and sodium. Special programs need to be intensified towards the youth of the Americas. Governments, in collaboration with the private sector, need to improve access to essential medicines and technologies for NCDs and promote appropriate use of drug therapy to reduce heart attacks and strokes. This whole of government and whole of society approach, which we discussed earlier this morning, implies automatically national and regional mobilization of government agencies, private sector, NGOs, specialized regional and sub-regional organizations. The OAS, I believe, can provide this collaborative platform and this environment, and is fully committed to facilitate such an encounter annually with identified partners. Ladies and gentlemen, in 2009, OAS member states, in the context of the Summit of the Americas, committed to reducing the burden of non-communicable diseases through, and I quote, through the promotion of comprehensive and integrated preventive and control strategies at the individual, family, community, national, and regional levels, and through collaborative programs, partnerships, and policies supported by governments, the private sector, the media, civil society organizations, communities, and relevant regional and international partners, end of quote. The OAS strongly believes that the public-private partnerships are key to addressing the challenge of NCDs in the region. Collaborations such as this one with the government of Trinidad and Tobago, Medtronic, and the Organization of American States, with support of the Pan American Health Organization, are crucial in raising the awareness of member states and encouraging them to take action and address NCDs in the Americas. We fully support the Pan American Health Organization in their efforts and recognize them as a lead agency in this regard in the Americas. PAHO and OAS have signed a strategic alliance in February 2014 to strengthen health education in the Americas. The two institutions signed an agreement as well to implement a scholarship program designed to increase training opportunities in the area of health, with emphasis in the production and use of research for health. The PAHO suggestion of a hemispheric interagency task force on NCD is certainly a worthy one. One I hope ministers and you all will endorse as a concrete outcome of this conference to facilitate coordination and collective action. Ladies and gentlemen, putting this conference together was an effort of many months and a real partnership between the Permanent Mission of Trinidad and Tobago, the team of Medtronic, PAHO, and our own staff at the OAS. And this, I believe, truly reflects the public-private partnerships we are seeking. And I want to thank Ambassador Neil Parsan and his staff member, Kanita Shah, for the initiative and collaboration, and through him, also the government of Trinidad and Tobago for the demonstrated leadership in placing this threat on the global and regional agenda and continue to keep it there. I thank the Medtronic team led by Dr. Trevor Gunn and Justin Kuster for the valuable input, and my own team led by Senior Political Advisor Shelley Das and supported by Adam Siegel and Mariette Fidel for the excellent substantive and technical preparations. Ladies and gentlemen, in closing, the fight against chronic diseases such as heart disease, obesity, cancer, and diabetes must and needs to be intensified. And I believe that today we have brought together an excellent team of experts with different responsibilities in society to discuss ways of tackling NCDs effectively to create a better, a more healthier, and also a more happier hemisphere. I thank you very much and wish you all the best. Ladies and gentlemen, in continuation, I'm going to invite Ambassador Neil Parshan to introduce our main speaker for this morning, the Honorable Minister Fuad Khan. Ambassador.
Good morning, distinguished ladies and gentlemen. All protocol as observed. My task is very simple this morning, and before I do my task, let me say thank you very much, Ambassador Randon, to you and your staff as well, Shelley, Adam, Mariette, for all the hard work put into this effort today, as well as the collaborators, Metronics, Dr. Gunn, Justin, and your team. Thanks again for this collaboration. Ladies and gentlemen, my task is to introduce to you the keynote for this morning's presentation, and it's the Honorable Minister of Health for the Republic of Trinidad and Tobago, Dr. Fuad Khan. Dr. Khan is a senior surgeon with a specialty in urological surgery. He graduated from the Institute of Urology in 1992, and he's also holder of the Fellow Royal of College of Surgeons, FRCS, in 1992. Dr. Khan is also a member of Parliament since 1995. He was elected in his first stint in Parliament, and at that point, he was also the Deputy Speaker of the House. He became Minister of Health in 2011, and he has been very, very instrumental in creating innovative approaches to the reformation process of our healthcare system in Trinidad and Tobago. He has pioneered the start of the HPV vaccination program in Trinidad and Tobago with great success, and he has also started the retinopathic management effort as well in Trinidad and Tobago. On a personal note, Dr. Khan represents the constituency in which I live, so I tend to keep him on his toes, but he's a dear friend, good member of Parliament, excellent Minister of Health, Dr. Fuad Khan, ladies and gentlemen.
Thank you very much, Ambassador Parson. Good morning to everyone here this morning, members of the head podium, ministers of health, distinguished guests, ladies and gentlemen. This morning we had a very wonderful breakfast meeting, and at that meeting the director of PAHOM, Dr. Carissa Etienne, addressed us on the problems of the NCDs, non-communicable diseases, that has become what we have now seen as an epidemic in our world. The World Health Organization, the Pan American Health Organization, and all others have expressed serious concerns over the last couple of years. And it began in the Summit of the Americas in Trinidad and Tobago, when the government of Trinidad and Tobago saw it fit to move a resolution about the non-communicable diseases and the effect of what non-communicable diseases will have on the population of the world, not just the region. Since then, a lot has occurred and a lot has happened, and a lot of information has been dissipated throughout the whole entire regions. And we've just heard some figures, how many millions of people die as a result of non-communicable diseases and their complications. In Trinidad and Tobago, when I became Minister of Health in 2011, the first thing I realized was the cost of dialysis that the Ministry of Health had to put out on a yearly basis. We started off with approximately $5 million for that first part of the year, and it jumped because of the need for dialysis to approximately $9 million, and it's climbing. What I also found out is Trinidad and Tobago, we had a high incidence of cardiovascular diseases. We had a high incidence per capita when you compare the United States. Per capita, we found out that, believe it or not, Trinidad and Tobago was higher. And ongoing, the cost of angioplasty, cardiac surgery, etc., was increasing. I looked also at the respiratory diseases of Trinidad and Tobago. And I also realized that asthmatic conditions, respiratory conditions, chronic bronchitis, etc., was increasing. But in one problem, that I noticed was that our young children under the age of 7 were starting to, when you observed it on an overall basis, I found that our young children were somewhat markedly obese. They had become round as compared to what I grew up with, which was hardly ever anybody had that obesity problem. I then looked around even further, and it did cause a couple of problems for me in the early days of being Minister of Health. When I observed in the movie areas, and I sat there and just people watched, and I'm quite certain a lot of people here do people watching. You watch, and then you look at a certain characteristics, and you decide what is it going to be. I looked at the young ladies of our country. Trinidad and Tobago, as you all know, has a carnival, one of the best carnivals in the world. And we also boast that our young women were fit. But I was looking on, and it struck me that approximately 40 to 50% of our young women were starting to get overweight. And I decided to ask the ministry to look into it. And then we had something called the STEPS program, where know your numbers, know your weight, know these type of things. And it brought out the fact that over the last 20 years, we had an obesity problem approximately 45 in some regions to as much as 55% of that category of the population. What do we do, and how did it occur? In 2000, I can't remember what year it was, I went to France, passing through England, and I realized that in England, the population was also overweight. When I went to France on a laparoscopic course, I realized in France, for some strange reason, most people there were slim, thin. And I asked myself, how come in France, the majority of people, and in Europe, the majority of people were of a certain body type, which is slimline, not obese. Passed through England, it was somewhat obese. And in the West Indies, where I came from, was markedly obese, and no offense to the Americas, also obese. Then I realized that they had less fast foods in France. I realized that the fast food industry had not yet captured the French population, and people were eating in France the normal food of the French diet. So I went back to Trinidad, and I realized that something had to be done. And I educated myself on NCDs, and thanks to Professor Aline, he started to push that at me, and we both worked together. And I came up with I realized that what was happening, there are combinations of food: salt, high sugar, oils. When mixed in that combination, together with something they call excitotoxins, as a result of the food industry. One of the excitotoxins that you tend to have in foods, and it's there, believe it or not, is something called monosodium glutamate, MSG, and its derivatives. You will find that it's in all sorts of, as I say, definitions. MSG. Sometimes you may find that this food has no MSG in it, but guess what it has? Hydrolyzed soy protein. And hydrolyzed soy protein is the derivative, comes off of MSG. And anything to do with the soy product tends to have that system. Mixing food together with the combination, the proper combination, which is the bliss point combination of what? Salt, sugar, and oil, fats, you end up with what we call an explosion. An explosion in what? The hypothalamus of the area, and what you call your satiety center of your brain. And we looked at that, and I decided that we have to do something about it, because that is what it was being fed to our children. That is what was being fed to our young people as a result of what we call the fast food culture in Trinidad and Tobago. And then I took it on myself to sort of say, okay, we have to look at the worldwide attitude. And speaking to Chile, the Chilean ambassador, they had started a move where legislation was done to attack the sugars. Sugars, the concentration of sugar in soft drinks and in food. I toyed with the idea of asking the Minister of Finance in the budget debate whether he could increase the taxation or some cost factor on the sugary and fizzy drink item. He has since looked at it. We are facing an election year, so I don't think he wants to upset much people, but that will come. As I've seen, Mexico has done it. Mexico has done it quite effectively. And that, I think, is the way the world is going to go. Because when we look at the non-communicable diseases, now we have non-communicable diseases, but we have the complications of the non-communicable diseases. We grew up, all of us grew up, our elderly parents and grandparents, we had diabetes, hypertension, or some form of that, and we accepted it as a part of growing old. But it's not really a part of growing old. This is a part that was taken as a result of poor eating habits, the poor diet, the lack of exercise, and that is what is occurring in our population today. So when we have this topic on NCDs, it just brings about the awareness of what is happening. We have done a good job in making everyone aware that there is an NCD epidemic, there is an NCD problem, there is an NCD thing that needs to be addressed. Because if we don't address it, 15, 20 years from today, the children of today will become the NCD complicators of tomorrow. The hospital beds will have to be increased. The amount of medication, different types of medication will have to be given. And we will get a population at the age of 30 having very, very serious NCD complications, which will be what? Cardiovascular diseases, diabetic diseases, hypertensive, strokes. And that is what we are giving to our young people. That is a legacy that we are pushing on them as a result of not capturing the reasons why they are going to be faced with NCD epidemic. We did a study in Trinidad and Tobago. You know what we found? Children under the age of 7 had type 2 diabetes because they were obese. They had high cholesterol at that age. So you can imagine that volume of children in the next 10, 15 years. You may get heart attacks at the age of 20. It's a frightening scenario. And as Minister of Health, I usually say I'm Minister of Health, of taking care of people who are sick, so I'm Minister of Health, but I'm also there to make sure that people don't get sick. And we have started a prototype of our health centers, and I'm building it in such a manner where these health centers not only take care of chronic diseases, but the majority part of it is they are going to be walk-in wellness centers where people could walk in at any time and get your numbers taken, your pressure taken, your blood sugar levels, your weight, and you're going to be counseled on what? On exactly where you're at based on a dietary pattern. I've also put in major areas that will have gyms and the facility that you can utilize to maintain or decrease the problem of obesity. So I'm hoping over the next couple of years, people buy into it. But I am faced with a serious problem. My health budget is the same, my total health budget is the same budget that the fast food industry uses for just the advertising. So I have to use my health budget to develop hospitals, to make sure the hospitals are taken care of, to make sure there are instruments in the hospitals and treatment is taking place. However, I'm up against the fast food industry. And what this industry does, the processed food industry, they are using the advertising dollars to combat what I'm doing. So I am going into the schools, I'm going towards a dietary plan and process in the schools themselves, and hoping to educate that group and push whatever I can in a campaign of education on the NCD epidemic and where they can be. It's no longer fairy tales and happy ever after. It's NCD time, and as a result of understanding that, if I could train the children in it, and we do have camps. We have a lot of things going in Trinidad and Tobago for that. And I just want to share something. The NCD Child first conference was in Australia. Our Professor Aline came to me and asked me if I could host the NCD Child in Trinidad and Tobago. I welcomed it because I used that situation and I used that conference to promote the need for children to understand that they could have the problems of non-communicable disease and the complications. So when you, in a nutshell, what we're doing here today, we are educating ourselves to go outside there to do what? To protect your children. At the end of the day, to protect yourselves. And if that is the message I could take this morning to you all, that is the message I want to take to you all. That this is not about just us. This is not just about older people with kidney diseases and the need for dialysis. This is not about older people for renal transplant surgery, which is what I do. This is not about cardiovascular diseases and longevity as a result of angioplasties and cabbage bypass, etc. This is about prevention. Preventing that problem, because guess what? That problem is real. And we could talk about figures. We may not be the statistics as yet, but your children definitely will be. So ladies and gentlemen, I want to take this opportunity to thank Ambassador Parson and Ambassador Ramdin, and all of you all for coming here this morning to listen to us. We're very happy with the turnout, and Trinidad and Tobago was extremely overjoyed when Ambassador Parson indicated to myself that we needed to push this NCD movement. And it's going to be intersectorial, multi-sectorial, as well as multi-country. And I hope to God that we win the war, because in other words, we need to protect our young people and our children. Thank you very much, and it has been a pleasure being here this morning.
Thank you very much, Minister Khan. Thank you very much for that practical insight on how to deal with these problems in our societies. Ladies and gentlemen, with this, the opening ceremony has concluded. We will immediately continue with the hemispheric policy dialogue and we have the pleasure to invite the Minister of Health of Mexico, the Minister of Health of St. Lucia, the Minister of Health of Paraguay, and the Minister of Health of Trinidad and Tobago to join us at the stage. Thank Ambassador Parson, who will join us later. And just to inform you that outside Johns Hopkins has a little table where you can do some measurements of some of the indicators with regard to your health. So make use of that opportunity. And also the coffee is outside, so feel free to step out. We will not have any coffee breaks, so it's up to you to do that. Thank you very much.